Dermatomyositis and polymyositis are going to be autoimmune diseases that are going to be characterized by symmetric proximal muscle weakness. Dermatomyositis is going to involve the skin. Polymyositis, we're not going to have any skin findings. That is the big difference between these two diseases. With dermatomyositis, we're going to have skin findings as well. Now, both polymyositis and dermatomyositis can be associated with cancer, especially adenocarcinoma. So if we are diagnosing a patient with polymyositis or dermatomyositis, we also have to work up the patient for a possible malignancy. Now, these two conditions can have autoantibodies associated with them. This can include anti-nuclear antibodies, which can be used to rule out other diseases. It can also include antibodies against tRNA synthetase, and this is very specific for dermatomyositis and polymyositis. So we can use these antibodies against the tRNA synthetase to diagnose dermatomyositis and polymyositis. The initial treatment for these two diseases is going to include systemic glucocorticoids like prednisone, and this makes sense because we want to calm down the inflammation that is going on with these two disease processes. Let's look at some of the skin findings that we would expect with dermatomyositis. Here we see the Schall sign, which is going to be the finding of inflammation of the skin in an area where normally a Schall might sit. We have a heliotrope rash, which is going to be the finding of rash on the face. As you can see over here, we have these rashes in the upper eyelid as well. Gartron papules are going to be papules found on the hands, most commonly the joints of the hands, as you can see over here. Now, in this slide, we're going to be going over another difference between polymyositis and dermatomyositis. Polymyositis is going to be due to endomysial inflammation with CD8 positive T cells, also known as cytotoxic T cells. So here we have a single muscle fiber. This muscle fiber is going to be covered by the endomysium over here. And the endomysium is going to be a connective tissue layer that is going to be protecting the muscle fiber. If the endomysium is inflamed, then muscle fiber can get damaged, and that can result in the symptoms of polymyositis. And the cells that are going to be causing the damage are going to be the CD8 positive T cells, also known as cytotoxic T cells. Dermatomyositis is going to be different in that the inflammation is going to occur in the perimysium with CD4 positive T cells, also known as helper T cells. When these muscle fibers bundle up together, they're going to form a fascicle, and these fascicles can come together and be surrounded by the perimysium, which is going to be a connective tissue layer that is going to be protecting the fascicles. Now, if there's inflammation against the perimysium, that can result in the symptoms of dermatomyositis, and the cells that are going to be causing the inflammation here are going to be CD4 positive T cells, also known as helper T cells. The way I like to remember this is that because the skin is going to be in the outer layer of the body, and because perimysium is more outer than the endomysium, this is how I know that the dermatomyositis is going to be associated with perimysial inflammation. I like to think of the P as an 8, and that is how I try to keep in mind that CD8 positive T cells are going to be the cells that are going to be causing the inflammation with polymyositis. The diagnostic criteria for dermatomyositis is going to include all of these 5 findings. We're going to see symmetric proximal muscle weakness, elevated enzymes like creatine kinase elevation, EMG abnormalities, muscle biopsy findings, and this can be diagnostic. With dermatomyositis, again, we might expect perimystial inflammation. And cutaneous findings, this is only seen in dermatomyositis. So we won't expect skin findings in polymyositis. If we only have these four things without number 5, that is going to be diagnostic for polymyositis. So that is the difference between the two again, is the involvement of the skin. The muscle biopsy findings for polymyositis is going to be endomysial inflammation.